All right, so welcome to Module 2. Let's talk about some of the symptoms of Parkinson's disease and how does it affect somebody. All right. Well, possible early symptoms, and this comes direct from Dr. Tony Lang at Toronto Western, an amazing gentleman I met about 5 years ago. The earliest symptoms could be, acting out your dreams. We're supposed to be without tone when we sleep. We're not supposed to be clenched up and all stiff and tight. Our muscles are supposed to be atonic or relaxed. Well, he talks in a study that was done, and I cannot remember the number of people, and another thing to go in the show notes and in the side notes, is a group of people they followed for years, where every single person they followed who acted out their dreams, and this would include restless leg syndrome, all ended up with Parkinson's. Okay, so that could be, he even says 30 to 40 years prior to knowing you have Parkinson's. Acting out dreams could be an early sign of going towards having Parkinson's. Okay, so very, very interesting. Loss of sense of smell. That can be one of the earliest ones for quite a few things. The top two I'd say that are in my head right now are Alzheimer's and Parkinson's. If you or somebody you know experiences a diminished sense of smell, you want to get to the doctor right away and have them take you seriously. And if they don't, get another doctor. All right. Because it's not normal to lose your sense of smell. Now, with COVID and all that, it could be a little different. Some people lose their smell and don't get it back at all, although I don't think that's real common. So I lost my sense of smell the first time I had COVID. I've had it twice. And it's back. No problem. Second time, no problem at all. Anyways, loss of sense of smell, that can be a sign of something going on in the brain, and you want to get checked out. Diminished arm swing, usually on just one side, where one arm doesn't swing as much as the other, or it's just hanging there and it's really not swinging at all. That can be an early sign of Parkinson's specifically. And also chronic constipation, that can be a sign, although we have a lot of constipation right now in society. But data shows us that chronic constipation could be a very early sign of Parkinson's. That would be pre-motor symptom. So let's go through some of the non-motor symptoms. Statistically, the number one, remember, this is just statistically, and please know that people with Parkinson's, no two people are affected alike. Each person with Parkinson's is uniquely affected differently. Very important to know that, right? Statistically, depression is the number one non-motor symptom of Parkinson's, followed by anxiety. All right, and we have a lot of other ones here. Apathy was recognized officially 6 years ago. Right now it's 2022, so in 2016, apathy was recognized as a non-motor symptom. A person could experience hallucinations and delusions. I work with several people here at my clinic who experience either of those or both of those. There are medications for that can be helpful. People with Parkinson's are six times more likely to get dementia. Okay, so we'll talk though in a while about, not today, but in another module about the intervention strategies of how we can help to prevent disease onset, hopefully, or delay disease onset, but delay disease progression and maybe improve memory, improve everything. That's a different module. Type 2 diabetics, which is very common these days, sadly, but it is common. They're 40% more likely to get Parkinson's disease, but they're also, they're gateways to many other health problems, cancers, heart problems, so many other things. But this is an interesting, sad statistic. Sleep dysfunction is not uncommon in Parkinson's. Behavioral disorders. So it's a lot of times will come from not, everything is generalized. Okay, but generally that can come from too much levodopa, carbidopa, cinnamate. Talk about that later. Impulse control, such as hypersexuality, shopping and gambling, too much, more than normal, that you want to get to the doctor and check out your dosage of levodopa, because too much of that can make people, I've known people personally who have lost a lot of money gambling or shopped and bought things they don't need, just shopping and shopping and shopping. Okay, so let's move on to a few more. Constipation, again, is a non-motor symptom, very, very common in Parkinson's. Orthostatic hypotension, I even get that, and I don't have Parkinson's, but that tends to happen, this postural hypotension. You go from sitting to standing, or especially laying down or sitting in a very low position, to standing up quickly, and then getting dizzy or lightheaded. Not uncommon in Parkinson's. Sexual dysfunction, urinary dysfunction, hyperhidrosis. This is not common, but I do see it sometimes. Very interesting. As far as I know, it's not dangerous as long as they're hydrating well, because they're burning a lot of calories. Usually, if they're in hyperhidrosis, excessive sweating. But if you see that, I don't want you to panic. Just know that it's something that it can happen. It's not common. And if it does, just make sure the person is hydrating, or that you are hydrating. Sensory dysfunction, again, loss of smell, visual disturbances. The retinas actually have dopamine in them. Okay, so there are perceptions, color perception, depth perception, and contrast sensitivity issues that can occur in Parkinson's. Somebody's walking, here's a classic example. They're walking just fine. They go across the room, and they're going to go to sit in the chair, and they're 2 or 3 steps away from the chair, and they stop and they pause, because they're not exactly sure where the chair is. They see it, but how far is it from them? That could be lack of dopamine in the retina. Remember, we have a lack of dopamine happening in Parkinson's disease. So not uncommon to have visual disturbances. Going through a doorway sometimes, or over a threshold, that can also slow people down. Okay. Pain. That's another one too. A lot of people I know with Parkinson's, a lot of people we work with, they have pain, and it's oftentimes, undertreated, underdiagnosed, or recognized, and they need help. So if you know of somebody with Parkinson's who has pain, or if you have Parkinson's and you have pain, go to your doctor and tell them about it, because hopefully they can help you out. But they probably won't ask you about it. All right. So you got to tell them about it. All right, let's go into some other final page here, I believe, of some non-motor symptoms. Reduced facial expression. Sometimes you might see what they call a mask face, where they could be smiling inside, or their eyes go up just a little bit. I don't know if you can see my fingers here by my eyes, if you can see me at all. But you can look at their eyes and say, oh, they're smiling, but their mouth is not moving or smiling. Reduced facial expression. Emotional changes. Cognitive problems, memory, thinking. Difficulty swallowing and chewing is not uncommon, and it can be very dangerous too. Speech changes. A lot of times it's just a softer voice, much softer. It's a LSVT Loud program. It's a beautiful program to help projection. We also go through that in other modules here later. All right. Articulation. Okay. We do this as well in further modules of how to articulate and project so people can hear you. Muscle cramps, dystonia. If you ever, Parkinson's or not, although this tends to be fairly, I'll just say it's not uncommon to have somebody with Parkinson's tell me, oh, my toes are just bent down and they're clenched into the floor, and the bottom of my foot is all crampy. They have like foot dystonia. It can be very painful. It might go away in 10 minutes, or it might be 3 days. We do have techniques to help get rid of that within a few minutes, usually in later modules. Fatigue and loss of energy is another one. So summing it all up, overall quality of life can be affected. It's going to be affected to some degree, with difficulty performing normal daily tasks. Things a lot of us will just take it for granted, but like writing or eating and using silverware, maybe cutting something with a knife, cutting your food, brushing teeth, getting dressed, typing and texting. I have people who tell me, if you text me and I don't text back, it's because I can't. My fingers won't let me. Taking a shower, going to the bathroom, getting in and out of a car, making turns, rotations, sometimes rolling over in bed is the first problem somebody faces. And then they can't get out of bed. We teach how to do that. Getting up from the ground, and so many other different things. So let's finish this up and go into primary motor symptoms. All right. We have 5 symptoms. You oftentimes hear about 4 symptoms, but we have 5. The most probably known and visible to us would be the resting tremor of a limb. All right. The next one would be rigidity, just really stiff, right? Stiffness and increased resistance to like passive movement of, the links. Oh, I have some articulation, limbs or trunk. My apologies. The next one is the one that's not that known. People are not aware of this, but akinesia. Okay, you're standing, you want to take a step, and you can't seem to get that first step. Yet you know you want to, but your body just won't do it. That's called akinesia, the loss or impairment of the power of voluntary movement. All right. Bradykinesia, slowness of movement. And then the one that's responsible for more falls being our #1 concern for the people in the Parkinson's population, postural instability. I see a lot of times it's a bent forward posture. The person has poor balance. The rigidity, bradykinesia, postural instability tend to be more disabling than the tremor, but postural instability causes more falls than all the other things above listed together. All right. So that pretty much concludes our symptoms in our little webinar here today. Other effects of Parkinson's disease, they may have impaired cardiovascular conditioning or function. Well, actually, what's interesting is the changes in the ventilatory parameters in the within the breathing area, the lungs, can cause problems breathing. Okay, so a lot of times, and plus add on the difficulty movement, and the person may not exercise really. So cardiovascular conditioning and function can be affected. And also somebody starts to withdraw from society a little bit because they're just self-conscious. Well, they might be pulling out of social relations and, just experiencing a loss there as well.